শুভ অপরাহ্ন। কাছে দূরে বিশ্বজুড়ে যারা যুক্ত হয়েছেন আপনাদের প্রিয় টেলিভিশন আরটিভির আয়োজনে সবাইকে স্বাগত জানিয়ে শুরু করছি বিশেষ স্বাস্থ্য আয়োজন হেলথ ফর অল। প্রিয় দর্শক, আজকের অনুষ্ঠানটি একটু ভিন্ন আঙ্গিকের। আপনারা জানেন, নানা কারণে প্রতি বছর বিশ্বব্যাপী অসংখ্য মানুষ বিভিন্ন জটিল শারীরিক সমস্যায় আক্রান্ত হয়। বাংলাদেশ সেই তালিকায় অবশ্যই অন্যতম, এবং প্রতি বছর বিপুল সংখ্যক রোগী বা রোগাক্রান্ত মানুষ ভারত, সিঙ্গাপুর, থাইল্যান্ড এই দেশগুলোতে চিকিৎসা করাতে যান। কিন্তু কি হয়, আমরা যেহেতু বিদেশি ভাষা বুঝি না এবং আগে থেকে সেই হাসপাতাল বা চিকিৎসা সম্পর্কে কোনো ধারণা আমাদের থাকে না, এই সকল ক্ষেত্রে কিন্তু আমরা রোগীরা নানা বিড়ম্বনা বা আর্থিক ক্ষতির সম্মুখীন হই অনেক সময়। প্রিয় দর্শক, আজকের আলোচনায় আমরা আসলে সেই বিষয়গুলো নিয়ে কথা বলবো বাংলাদেশ এবং থাইল্যান্ডের পারস্পরিক সম্পর্কের 50 বছর নিয়েও। আর আজকের আলোচনায় আমাদের সঙ্গে যুক্ত হয়েছেন থাইল্যান্ডের অন্যতম প্রখ্যাত হসপিটাল ব্যাংকক হসপিটাল বেশ কজন বিশেষজ্ঞ চিকিৎসক। চলুন তাদের সাথে আমরা প্রথমেই পরিচিত হব। হ্যালো, ওয়েলকাম এভরিবডি। ইউ আর ওয়েলকামড টু আওয়ার ভ্যালুড প্রোগ্রাম হেলথ ফর অল। We are introducing yourself. Please, first of all, Dr. Dhun Damrongsak, Assistant Chief Executive Officer, Bangkok Hospital Headquarters. Hello.
Yeah, hello, Swadikam.
And Dr. Yossavee Ukkayagorn, Cardiologist.
Hello, Swadikam.
Dr. Phonthakorn Panichkul, Orthopedic Surgeon.
Yeah, thank you.
Thank you. And Dr. Satit, Srimontayamas, Oncologist and Medical Director of Breast Cancer Department, Bangkok Hospital. You all are welcome to our program. Now we can start our discussion. First of all, I would like to ask a question from you. Is it your first time visit in Bangladesh?
No, this is my second time visit Bangladesh in Dhaka. My first time was in 2003, which is about 20 years ago.
Okay, it is your second time visit. So
right.
Can you see any difference or what is your experience between these two visits?
Yes, it's much different. Because my first time, at that time I was a doctor, we do the evacuation by air ambulance to come to Dhaka to pick up one of the foreigner patients who work in Dhaka, and then we bring him back to Bangkok. So I have a chance to visit your medical facility at that time, and compared to today, that this is my second time, I can see the difference, which is much improving. Again, at that time when I was here, the cath lab or cardiology is only one cath lab in the country. But today, when I talk to some of your cardiologists, you already have 90 cath lab in Dhaka, which is a lot of improvement. So I would say yes, everything is much improved in Dhaka today.
You were telling that before 20 years you saw one cath lab only in Dhaka city, and now it is several numbers of cath lab we
That's
have in
correct.
Dhaka city.
Yeah.
And you must know that the health sector and hospitals of our country is improving day by day, and health system is improving day by day in our country.
That's correct.
Thank you. But after that, how our patients are going abroad, you think? What is your thought?
Yeah, I think in some area there is we have more and more technology and advance, and I think Thailand is one of the country that we have some good hospital. In our hospital we open 52 years now. We are focused more on the cancer,
Okay.
brain and bone, and also heart disease. So again, in this 4 area that I mentioned, we are one of the leader in the region. So that is why in some area we still can sharing our knowledge with the professional here. And today again we bring some of our expert or specialists to come to give you more detail on that.
So you are focusing on the recent advancement of treatments, and you mentioned the cancer or bones and neurospecific treatments or intervention treatments like this. So some people are traveling, of course. Now I would like to talk with Mr. Yossavee. I would like to ask you, since you are a specialist in cardiac arrhythmia, so could you please tell us more about the symptoms, signs and symptoms of cardiac arrhythmia?
For the cardiac arrhythmia, it vary from no any symptoms to the symptoms until sudden death. Okay, some people who come to the hospital, they may do the cardiac checkup or annual medical checkup, and we found that they have the cardiac arrhythmia from the ECG by chance, but they don't have any symptoms.
Okay.
But some people who have the symptoms and come to the hospital, such as the palpitations, lightheadedness, dizziness, chest pain, fainting, shortness of breath, until sudden cardiac arrest.
So you are telling that there may be no symptom
No
or
symptoms.
some symptoms you have already mentioned.
Yes.
If there is no symptom,
Yeah.
then how it can be diagnosed, or
Okay.
what the general people do when there is no symptom but he is attacked?
Okay, I usually recommend the people to do the medical checkup.
Medical checkup.
Medical checkup, and we can see the cardiac arrhythmia from the ECG. It's the easy way to do the ECG because it takes time only 5 minutes. We can see the ECG, and it can show that they may have the cardiac arrhythmia. That may do further investigations, such as the echocardiogram, exercise stress test, cardiac MRI, until the proper treatment.
ECG is the single best, most diagnostic tool, and then if you need, you can do further investigations.
Yes.
In your hospital or in your country,
Yes.
what type of patients you visit more from abroad?
Okay, it's vary from the normal cardiac checkup.
Okay.
Just come to
Normal
do
cardiac
the
checkup.
annual medical checkup, and we can see the arrhythmia. Or they can come with the symptoms such as the palpitations. Most of them is palpitations, or shortness of breath, easily fatigue.
Palpitation.
Outpatient basis, or they can be transferred from the ambulance with the arrhythmia. Most people, most arrhythmia that we can find is atrial fibrillation.
Atrial fibrillation.
Atrial fibrillation is the most common
Common
arrhythmia.
cases.
Yes.
So you find most the cases of atrial fibrillation.
Yes.
And what should be the treatment options? What do you do first in a patient of atrial fibrillation?
Okay. From the atrial fibrillation, nowadays we don't know the cause, but most of the disease or conditions can aggravate the atrial fibrillation. Such the disease that can be the link to the atrial fibrillation is maybe diabetes, hypertension, previous stroke,
Comorbidities.
coronary artery disease, or the obstructive sleep apnea can cause the atrial fibrillation. And then I will talk about the management. The management will be divided into two parts. The first of all, we should control the rate of the atrial fibrillation.
You should control the rate
heart
first. Heart rate first.
And then the second is to prevent thromboembolic stroke with the oral anticoagulation. Yes.
Thank you, Dr. Yossavee, for mentioning the symptoms and immediate treatment of cardiac arrhythmia and atrial fibrillation. I will come next. Now, I would like to ask Dr. Satit Srimontayamas. Dr. Satit, since you are the medical director of breast cancer department of your hospital, would you like to share more with us about the early symptoms of breast cancer, please?
So the patient with breast cancer can present with various symptoms. The breast mass or lump in the breast is the most common symptom for the breast cancer, and other symptoms such as the mass at the underarm, ulceration at the breast, bloody nipple discharge, or breast deformity or breast pain. But the patient who present with these symptoms may not be the early stage of breast cancer, because the patient with early stage breast cancer are usually asymptomatic or no any symptoms. The patient come to the hospital for the general health checkup or breast check by mammogram and ultrasound, and the result shows something wrong in the imaging, such as the mass, the abnormal calcification, or only the small breast mass. So if the image show the suspicious mass, the doctor will advise the patient to have the needle biopsy, and the treatment is based on the biopsy result. Yes.
These are the symptoms, and you mentioned that there may be some variations.
Yes.
And there may be no symptoms
No
in the
symptom.
earlier stage,
Yes.
and people cannot recognize the symptoms sometimes.
Yes.
So, if it is lately diagnosed, what should be the outcome?
So, if we found in the late stage of the breast cancer, the treatment is more difficult, the outcome is not good, the patient have to more treatment such as the surgery, chemotherapy, radiation, targeted therapy. So the period or the cost of treatment may be longer,
Cost of
maybe 1
treatment
year. Yes,
maybe,
yes,
much
yes.
more.
Compared to the early stage.
Compared
The
to the
patient may
early
have
stage.
only the surgery or only the oral medicine. So the treatment may be short, the outcome may be is much better, and the quality of life is much better as well.
Can you tell me the early diagnosis and prevention? What should be your advice to the patients? What should be the process to prevent the breast cancer?
Okay, because we don't know what is the cause of the breast cancer, so the prevention is very difficult. But we know the risk factor of the breast cancer.
You know the risk factors.
Yes, some risk factor cannot be changed or cannot be modified, such as the age at the first period, the age of menopause, the familial history of the breast cancer.
These are the non-modifiable
This
risk factors.
cannot modify, but some risk factor can
Can be
be
modified.
modified, such as the obesity, the hormonal use, the lack of exercise, fatty food, or something like that. If we change or we modify lifestyle to eat healthy food, to reduce, control body weight, to do the screening. All women should check their breast by herself every month, and after 40 years old, they should see the doctor to do the clinical breast examination by doctor and to check by the mammogram and ultrasound. Yes, every year.
Thank you, Dr. Satit. Now, actually, we have a time for break, and we will come back after the short break. প্রিয় দর্শক, আমাদের আজকের বিশেষ আয়োজন হেলথ ফর অল অনুষ্ঠানের এই পর্যায়ে খুব সংক্ষিপ্ত সময়ের একটি বিরতিতে যাচ্ছি আমরা। কিছুক্ষণের মধ্যে ফিরবো, আমাদের সঙ্গেই থাকবেন। প্রিয় দর্শক, বিরতির পর আবারও আপনাদের স্বাগত জানাচ্ছি আজকের বিশেষ আয়োজন হেলথ ফর অল অনুষ্ঠানে। আজকে আমরা আলোচনা করছি থাইল্যান্ড থেকে আগত বিশেষজ্ঞ কয়েকজন চিকিৎসকের সাথে। আমরা ফিরে যাচ্ছি আমাদের আজকের আলোচনায়। বিফোর দ্য ব্রেক উই টকড অ্যাবাউট সাম সিমটমস অন ব্রেস্ট ক্যান্সার। নাও আই উড লাইক টু আস্ক ডক্টর Phonthakorn, as you are an orthopedic surgeon. So I would like to ask you, since Bangladeshi people are very much into sports and they're habituated in sports, what are the common type of patient you have noticed from Bangladesh in your country or hospital?
Yeah, so there's a lot of the injury patient, let's say from the sport injury. So let's say the ACL or tear of the ligament in the shoulder that come to our hospital.
Ligament injuries.
Yeah, ligament injuries, any part of the body. We have a lot of patients from your country to seeking for the surgical treatment to fix the ligament and also the pain after the injury, because not only the injury can cause the pain, but some patients they have injury but they just leave it. There's no further treatment. At the end, they create we call the arthritis of the joint. Let's say if you have an ACL tear and they didn't have a good treatment, they have the arthritis after the injury. So we have two groups, the patient that come from Bangladesh. The first one is the direct injury. The second one is the sequence after the injury, let's say the arthritis.
What is the process or how long it takes to cure up the ligament injuries? Because most of the players and most of the young guys who are habituated in different kinds of games, they have the ligament injuries. So how long it takes?
So normally it takes very fast. Normally because we have the good treatment option for this group of the patient. We call the minimal invasive surgery. When the patient have the big tear of the ligament, we have the arthroscopy to fix that. We have the joint replacement in the patient that need the hip on the knee replacement. So the recovery is very fast. So normally take about 1 month after the injury, they can they can go back to work and they can return to sport maybe 2 months after the surgery.
Can you tell about some joint replacement surgery or facilities of joint replacement surgery, and what are the outcome of joint replacement surgery in case of sports injury or any other severe trauma, please?
It's very fast right now because in the past we have the technique we call the conventional technique for the joint replacement surgery. The recovery is very, very slow. The patient stay in hospital for 7 days or 2 weeks, and they cannot walk well because of the pain and the more muscle damage for the injury. But the technique that we use for this group of the patient is we call the minimally invasive. We have the technique for the hip replacement that we call the anterior approach, and we are the pioneer of this technique in Asia. Some of your doctor come and learn with us for the treatment this technique as well. So the recovery is very fast. After the hip replacement, they can walk the day of the surgery. They can discharge home within a couple of days after the surgery. They can do going up and down stairs within a couple of days, and they can return back to work 2 weeks after the surgery. This is we call the novel technique that can help to improve the quality of life of the patient.
In short, would you please tell us the indications of hip replacement or knee replacement surgery? Just indications.
Easy one, very short one is if the patient need it.
If the patient need it.
So not every patient that need the surgery, when they can tolerate the pain or the dysfunction, there is no need to have the surgery because every patient try to avoid the surgery, right? No, surgery is better than the surgery, but when the quality of life of the patient is get to the level,
quality of life is
it's very bad, and they feel that okay, I cannot tolerate with this type of the disability, they can come and decide for the joint replacement. This is one of the most successful operation in the world that create the new quality of life and new mobility for the patient.
Thank you very much for giving us the information about orthopedic surgery in your hospital. Now again, I'm coming back to Mr. Dhun. You are taking care about the hospital management system as far as I know. So what is the most important thing of hospital management system, what you are looking for?
The most important in terms of management, look after the hospital is the quality of treatment.
Quality of treatment.
Because of the, so at the end of the day, everyone have to look into the result, and the quality of treatment is the most important. But to have a good quality of treatment, the human resource is the most important. You need to have a good doctor, you need to have a good nurse, good pharmacist, and good technician. Again, like doctor or the specialist mentioned, not after the medical surgery, you still need rehabilitation. You still need a plan for to return to work or to return to play the sport again. So then the human resource of the healthcare people is also very important, and that is why hospital management now they have to focus on this quality of the treatment.
Mr. Dhun, what is your idea about the collaboration between different hospitals and two countries?
Yes, since we have Bangladesh patient fly to Bangkok for treatment, we also would like to find a hospital here for some of the collaboration. So after we send the patient back home, then they need continued treatment in the country, and that is why it's very important to have some kind of the collaboration with the hospital here.
Thank you. Now I would like to ask again Mr. Yossavee, can you please tell about the interventional treatment procedure during cardiac arrhythmia?
Yes, the cardiac arrhythmia, okay. Nowadays we can be divided into the many options for the treatment. The first of all is the medications. Medications can control the heart rate or the antiarrhythmic to control the rhythm, and oral anticoagulant to prevent the thromboembolic stroke. And the next one is the ablation. Ablation for the cardiac arrhythmia is some cardiac arrhythmia, such as the supraventricular tachycardia. It can be cured more than 95%. But for the atrial fibrillation, it's around 80%. It depends on the timing of the arrhythmia that persists in each patient. And another one, is a pacemaker. The pacemaker is an indication for the slow heart rate, such as the complete heart block or sick sinus syndrome. And the next one is the AICD, automated implantable cardiovascular defibrillator. Okay, most people who have the coronary artery disease and suffer from the low ejection fraction, low heart function, is prone to be the life-threatening arrhythmia. We call the ventricular tachycardia or ventricular fibrillation. And okay, this is an indication for the AICD implantation. And the last one is CRTD. CRTD is like the combination of the pacemaker with the AICD, because most people who have the heart failure, and we try to give them with the medications to modify his heart, but it's still low ejection fraction, less than 35%, and still has the heart failure. So we use the CRTD to pace both of the right and left ventricle simultaneously to improve the heart function besides the medication. Yes.
Okay. Thank you very much for giving us the information about pacemaker and some other treatment options during treatment
the
of
heart disease.
Yes, heart disease. Thank you. Now I would like to come again, Mr. Satit. You are an oncologist and breast cancer department you are working. Sometimes we see you are giving treatment in chemotherapy or radiotherapy or operation. So what is the treatment option of what condition? Can you please explain in short, please?
Okay. So the treatment of breast cancer is not only one modality, not only surgery, but the patient need is called adjuvant therapy after surgery, such as the chemotherapy, radiation, targeted therapy, and now we have the immunotherapy. Okay. So it depends on the stage of the disease, state of cancer.
Stage of the disease and stage of the cancer.
Yes, not only state, but now we have to know the type of the cancer. Because now there are about 4 or 5 subtypes of the breast cancer, so the treatment is different. Yes, and now the technique or technology of the surgery and the chemotherapy, immunotherapy, targeted therapy is much developed rather than in the past. Yes, so now it helps the patient to have the good quality of life and prolonged survival.
Thank you. Thank you very much for giving us the information. And I would like to thank you again, all of you, for coming to our studio and have the important discussion with us about so many subjects like breast cancer, orthopedic surgery, and you cardiologist and overall hospital management.
Thank you very much.
Thank you. সুপ্রিয় দর্শক, এতক্ষণ আমরা আলোচনা করেছি বিভিন্ন বিষয় নিয়ে আজকের এই হেলথ ফর অল অনুষ্ঠানের বিশেষ পর্বে। বিশেষ করে আমরা আলোচনা শুনেছি হৃদরোগের আধুনিকতম চিকিৎসা পদ্ধতি সম্পর্কে বা অর্থোপেডিক সার্জারির চিকিৎসা পদ্ধতি সম্পর্কে এবং ব্রেস্ট ক্যান্সারের বিভিন্ন স্টেজের চিকিৎসা পদ্ধতি সম্পর্কে। আমরা যখনই অসুস্থ হই, আমরা দেশে অথবা বিদেশে যেখানেই চিকিৎসা গ্রহণ করি না কেন, আমরা প্রত্যেকেই চাই সুস্থ হয়ে বাড়ি ফিরতে এবং আমরা প্রত্যেকেই চাই সুন্দর হাসপাতালে একটি ম্যানেজমেন্ট সিস্টেমের মাধ্যমে আমরা আমাদের চিকিৎসা সেবাটি পেতে। আমরা যখনই অসুস্থ হব তখন আমরা যদি সঠিক সময়ে রোগ নির্ণয় করতে পারি এবং সঠিকভাবে চিকিৎসা সেবাটি গ্রহণ করতে পারি, তাহলে দেশে অথবা বিদেশে যেখানেই আমরা চিকিৎসা নিতে যাই না কেন, সেই সময়টিতে আমাদের প্রত্যাশা থাকে সুস্থ হয়ে উঠবার। প্রিয় দর্শক, আমরা যাতে সকলেই এই বিষয়গুলোতে সচেতন থাকি, আমরা সঠিক সময়ে রোগ নির্ণয় করতে পারি, সঠিক চিকিৎসাটি নিতে পারি, তাহলেই আমাদের সার্থকতা। এই আজকের অনুষ্ঠানটি দেখবার জন্য আপনাদের সকলের জন্য অনেক অনেক শুভকামনা।